I've suffered from depression myself, and I've been in need of support of this kind previously, so I'm aware of how important it is for people in New Zealand. New Zealand is really overrepresented in a number of different areas in suicide statistics, and unfortunately statistics are only a small slice of the actual problem.
The basic point of the program is actually to save lives. I think many people would find suicide quite a scary thing to be confronted by. It comes with a huge amount of distress, and if someone shows signs of that kind of distress where they're thinking of ending their lives, people are often quite worried about how to help that person. They don't know how to help that person. They might prefer not to know. So what we do in this program is to help people overcome those internal resistances to actually getting involved and just extending their hand and helping that person.
It's usually quite scary when you come across someone who is disclosing to you about, suicide thoughts. And ASIST really helped me to organise what I need to ask them or say to them, to organise it in a systematic way to help them get out of these mindsets.
When I first started at the lowdown, I was quite anxious about working with suicidal behaviour and not quite sure what to do and how to manage it, and especially working with a medium. The text medium is quite hard, so it gave me a lot of confidence. I felt less anxious. I was able to assess the risk. I was able to pick out the triggers and use the intervention, so it was quite a useful tool for me.
I guess the first thing they have to do is to actually notice that someone is really distressed. So we teach people how to recognise the signs of that distress. And then the next thing is to actually give them the courage to ask the question. Are you thinking of killing yourself? Are you feeling suicidal? That, I think, is probably one of the most difficult things that many people are asked to do or feel challenged to do. And often there are cultural taboos around actually naming suicide. So that's a big part of what we're doing in this workshop over those 2 days, getting people used to, through practicing and hearing other people practicing, just how to raise that question. Are you feeling suicidal?
I think the more that it's talked about, the less taboo it's going to become, and therefore people who are feeling isolated and suicidal and alone are hopefully going to feel less alone and more inclined to perhaps put those invitations out, those signs out, and reach out and ask for help if it's open and talked about in the community.
When you're dealing with issues like suicide, it's something which is best responded to on a community level. It can happen anywhere, and the more people who know about it and know what to do, the more effective they are at helping people who feel that they are in that position.
I know of people who have had people very close to them who have committed suicide, and so I was actually looking forward to being able to have some tools to talk openly with them about the effects of it afterwards. And because I know that in situations where people have lost somebody really close, that kind of thing, depression can be hereditary. And for instance, a friend of mine, has teenage daughters that are dealing with, all of this now as a result of losing their father through suicide.
I thought it was going to be a course that's mainly theory-based, so we come into a classroom with a notepad taking down notes about theories and approaches, but it's completely different. It's very hands-on, and we get in small groups and discuss, and we get to do enactments of scenarios, so it really tests out your skills at the end. So it's really interactive.
It was a 2-day intense workshop. You get theory, you get sort of the workshop material, and you get to practice, which incorporates the whole model in front of people and doing role plays and things like that. So I would definitely recommend it to people It's been quite a useful tool, and I wouldn't have been able to work with suicidal behavior in the way that I have been if it wasn't for it.